Welcome back to Taking Charge of My Cancer podcast. And I have a really great guest today. Her name is Karen Perrin, and she is a nurse practitioner, board certified by the ANCC in adult health since 2001. She has over 30 years of nursing experience in various clinical settings. She earned her bachelor's and master's degrees in nursing from the University of Florida, and the next 14 years were in a burn intensive care unit at UF Chance Hospital. Well, then she coordinated several clinic trials and care for burn patients from ICU admission through their hospital stay and to a follow-up care. Shifting gears, she worked as a clinical leader in the neuro ICU, and she became a nurse manager for 24-bed vascular ICU and neuromedicine. She has participated in numerous abstract submissions and presentations. Additionally, her name was associated with four professional publications. Her most recent publication is entitled Catheter-Associated Urinary Tract Infection in the neuro ICU. Then in 2022, she transitioned to her current role as an advanced practitioner provider for medical oncology within UF Health Chance, and she focused on melanoma and breast cancer. Karen is passionate about delivering quality care and enhancing the patient experience as they navigate the complex health system. Most recently, she earned her doctorate of nursing practice at Chamberlain University. An example of her commitment to enhance a positive patient experience, her doctoral practice project centered on the importance of a standardized distribution of survivorship care plans to improve satisfaction for breast cancer patients. She was inspired to become a nurse practitioner, what led her to specialize in medical oncology. So, Karen, thank you so much for you being here with me today.
Yes, thank you.
So, tell me a little bit about what inspired you to become a nurse practitioner and what led you to specialize in medical oncology.
Well, I think through the years, many years of nursing practice, I think all the patients over the years, things that I learned from them, I always wanted to be a lifelong learner. So I just kept going. I really like the role of the nurse practitioner because it can help the whole patient. As far as why I chose medical oncology, I'm actually a breast cancer survivor myself, and really felt like I could give back to the community, and I'm super excited to be here.
Oh, wow, that's amazing. I didn't know, realize that.
Yeah.
So, if we go back a little bit into nurse practitioner, will you explain our audience what is the difference between a nurse and a nurse practitioner?
So a nurse practitioner has to have a master's degree, and it is a different perspective. You're actually able to diagnose and treat a patient, prescribe medications. So it's a lot more autonomous than maybe a bedside nurse or a regular RN.
I got you. And if we go back into the other part of your answer, you want to tell us a little bit about your story as you went through breast cancer.
Well, luckily, it was caught very early in a screening mammogram, so I was very fortunate, and therefore went through surgery, had a lumpectomy, and then went through radiation,
Okay.
and then took tamoxifen for 5 years.
Okay. Okay. Very good. So, um, how long ago was that, Karen?
I think it's been 2016,
Okay.
2017. So I've completed the 5 years of
I
tamoxifen.
got you. So, I have two questions from that. One is, if you look at how you were treated back in 2016 versus now, you want to tell us how much difference it is in how we treat breast cancer patients now versus then?
I think not a whole lot has changed, maybe. I think maybe the surgical procedures are a little more advanced. I think radiation might have changed a little bit, but I don't have as much experience down there. But I think that they've maybe lessened the amount of time that you go through that.
Yep. Yeah. And then the other question was, you were 5 years into tamoxifen. How was that for you?
I actually did very well. I didn't really have hot flashes or anything until way after I stopped taking it. So
Okay.
I
Okay.
really didn't notice any side effects from it. So I
Okay.
was very fortunate.
And are you okay? What is it that what are your thoughts about? So you finished with your 5 years. I'm assuming that you were hormone positive cancer, right? If you have to
Yes.
have tamoxifen. But are you okay to do hormone replacement, or how do you navigate through menopause and help your system going through all that?
Yeah, well, I've been really leery about doing any of that. So I've just been using some of the like medications like oxybutynin for the hot flashes and kind of buying my time.
Okay, okay,
So,
okay. So what are your opinion on that? I know you've been hesitant about it, but what are your thoughts about it?
well, I just think from what I've read, um, I think it depends on the cancer, which type. There's so many different kinds of breast cancer, as you know. So I think maybe mine was like a DCIS
Uh-huh.
more so. So maybe in my case, it might be okay to do a low dose estradiol
Okay.
um, cream,
Mhm.
but it's still in the back of your head that you just don't want to contribute to anything that could happen.
Okay, got you. Okay, very good. Can you share a memorable patient story that shaped your approach to care?
I think there's so many.
I'm sure.
I really think I learned just a lot over the years, and I really like nursing in general because I feel like it kind of gives you a sneak peek into other people's
Mhm.
world and how they survive things, how they deal with things, and seeing them get through to the other side has really, I don't think a lot of people get to see that. So it helps you appreciate kind of what you have and the people in your life.
Okay. Is anything remarkable? Anything like you say, oh my God, this person really made me realize something.
Um, I mean, there's so many different, like even with the burn patients, there was
Yeah. How
some,
about now in your new role, like working as a nurse practitioner as in the survivorship program?
yeah, I mean, I've certainly run across a lot of people that are inspirational and a lot of people that struggle, that I feel like I have a purpose to help them get through this. And yeah, I've learned a lot from them too.
What
There's some tough people.
Yeah, what is one thing you think you have been learning that you can share?
Learning mainly the treatments,
Okay.
there's so many different, so and it's ever changing. So I think trying to stay on top of the new treatments and the side effects and all that so I can be the best provider I can.
Okay, perfect. And how has your role evolved over the years in oncology cares? Kind of like very close to that question.
Yeah, I think it's going to get more and more expanded with the decrease in medical oncologists. I think they're going to need nurse practitioners and PAs to really um, handle a lot more and work to our scope, full scope of practice. For us, we've evolved in like maybe seeing more patients, not exactly prescribing more things because we're limited in that, but generally just the amount of patients we see. And I, we're hoping, I'm not disease specific, so I see all different kinds of cancer. I just
Okay.
mainly focus on breast and melanoma. So
Okay.
I've got a lot to learn on all of the cancers.
Yes, yes, got you. So you want to explain to the audience as well, what is the survivorship program means?
Okay, so the survivorship care plan, what I noticed when I got here is that it's a great summary of the whole cancer journey from surgery to what their genetics were to their surgery. So it's all listed in a packet, kind of a paper packet. Historically, that was mailed to patients and it wasn't really consistent. It follows the guidelines, which is what we want to do.
Mhm.
But when I asked people about it, they didn't know what I was talking about. So there's a whole program that does the data collection. The whole cancer center is a huge place. So for my project, I focused on getting the survivorship care plan available to me, and I would print it out and ask them questions before I printed it out, before I gave it to them, and then I would deliver it to them,
Okay.
like go through piece by piece what all it says in there, and then um, and then have them retake another survey. And my goal was to improve patient satisfaction.
Okay.
And it did show that it improved patient satisfaction. And most people wanted it like right after they finished active treatment, and they wanted it delivered in person.
Okay.
So we're kind of trying to adjust that now, and I think we've done pretty well in getting it out faster and getting it delivered in person, mostly with the breast surgery group, but sometimes we do it as well.
Okay. Great. What unique perspective or skills do nurse practitioners bring to oncology treatment planning?
Well, I think nurse practitioners, they don't just look at the treatment plan; they look at the whole person, including the family. All of the social aspects, like what barriers to care there are. So we're just trained to really look at the whole person,
Mhm.
and spend a lot more time listening and going, you know, what the patient needs.
Yeah. Okay. I think that's so important. What I hear a lot. And I don't know how often you see the patients, but I hear a lot sometimes patients saying, no, the doctor just spent 5 minutes with me. They throw all this information. I have no idea what they were talking about. I heard something about my heart, and I heard something about neuropathy, and I heard something about my hair and my nails, and that's all I know. So
Yes,
I'm kind of glad that, and I know sometimes can be the case as they go in initially and see actually the medical oncology, but I know that sooner or later you will be seeing them, right? And then hopefully spend that teaching and time and help them to cope through those side effects and so forth. So
yes.
glad you're there for them on that. Um, how do you approach those first often overwhelming conversation with newly diagnosed patients?
Well, I think you're right. They're totally overwhelmed. They've been just given so much information. So I really do spend a lot of time just kind of seeing what their understanding of the treatment plan is, kind of go through everything if they know the schedule, and kind of taking a step back and just find out what their understanding is, and listen. There's a lot of listening, and answering questions, because I feel like you have to build that relationship also, because I do see them a lot and often. So I want to make sure they have all the information they need.
Yeah. And again with that as well, I'm sure that um, you can help them. I literally just saw a patient that you actually have not seen. You're about to see her on next week on Thursday. And little simple things that, oh, I thought that I'm afraid to jump or run because I don't want my cancer to continue spreading out. And it's like,
Mhm.
man, it's like how much misconception of the cancer out there for patients, right? And to kind of like, wow, like I did not realize like at this point, right? Sometimes you're thinking, no, we're coming along so much better. I remember like what, 16 years I've been doing oncology, and I remember then thinking, or even then, a lot of the patients were like, well, no, you gotta take it easy, just kind of you go in bed and everybody comes and bring you food, and then you just really don't move. And now I'm like, no, 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 you have a gym, you need to start tonight and you got to start working out. And this is all the list of why it's so important to kind of get going before you even start chemotherapy. And then she's like, well, I feel like you're preparing me for a war. It's like, well, this kind of, we kind of really working on how can we mitigate and how can we make our bodies as healthy as possible. So we have less secondary effects because this is toxins coming into your body, yes, to kill the cancer, but still toxins that the more we can get your body healthier, hopefully the less effects you're going secondary effects you're gonna have. So that kind of glad that you're doing that. Cancer treatment can be physically and emotional very draining. What strategies do you use to help patients cope with it?
Well, I think again, the listening, really going through what resources are available, finding out what barriers they have, because often they don't tell you, oh, I couldn't afford my medicine, or I couldn't afford the nausea medicine, my insurance didn't pay for it. And for some reason, they don't necessarily always bring that up. So then if they do, and I find out, I can get with social work and try and find a resource for them and to help. And then I also want to see what family support they have, and sometimes it's just friends, sometimes it's family, um, sometimes it's bringing people together that you wouldn't think, you know.
Mhm.
So
Do you usually refer them for like psychology, like support or those kind of things, or do we have like a breast cancer support group that you refer them to?
we have two social workers up here that are really active in helping our patients. There is a support group, but I don't think it meets that frequently. I feel like it's quarterly, maybe. Um, I think Dr. Daly and Dr. Helderman may initiate some of the psychology referrals.
Okay.
Um, I haven't done that as much, but I could if they wanted it. So,
Okay. So, and I'm not too sure if you're aware of that, we have an occupational therapist here, a couple that they do a lot of the mental health part of it.
oh, okay.
Well, for our breast cancer patients, when we see them pre-op, right, so usually, Dr. Spiegel refer them pretty much right away. So we see them within 2 weeks of diagnosis for the most part, and then Tony see them pre-op, and that has been really a great opportunity because again, he helps like do an evaluation and really help out with like the coping part of it. What else can you
Yeah.
do? What's happening? Those kind of things. And a lot of the patient has been finding that is very helpful. And again, some of them is like, no, I'm just gonna teach you stuff and you should be good to go, but I'm here if you need me. Some of them they need to continue seeing him on a regular basis because they're struggling more. But so is there, and then I'll
Okay.
be happy to kind of email you the referral number and all that, but that has been very helpful.
I can.
How about nutrition? Do you guys usually refer everyone to nutrition or how that works?
Nutrition's tricky. When you go to put that in, it has to be put in by a physician. And
Okay.
I'm not really sure, so I can't put in those referrals.
Okay.
I think that would be great, and I think maybe that's the ultimate vision for the cancer center is to kind of bring it all in, and I think that would be fabulous because
Yeah.
I do have a lot of people ask what they can or cannot eat. Should I avoid sugar? Should I avoid red meat? There's just
Yeah.
lots out there of
Yeah.
people saying what you should do, but.
Yeah. So what do you tell them when they ask you that? Like if we go back into like the sugar myth, what are your thoughts on that?
Well, I am kind of the camp where probably eating healthy is the best. But I think everything in moderation. And I also think that you're so stressed with the new information that trying to then change your whole diet and get rid of things that have been kind of a comfort for you is maybe not a good idea at that point.
Okay.
Once to like not be able to have sugar or chocolate or something if you need that. So I kind of think everything in moderation, I
Okay.
guess my answer.
Uh, Same thoughts with like red meat.
Yeah.
Okay.
Sometimes I want people to have red meat so their hemoglobin goes up.
Got
So
it. You got it. Yep, 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 yep. That's exactly right. And any supplements like, protein intake, anything on those lines.
yeah, I always think a good high protein, you know, not necessarily high calorie in every person, but some people need the high calorie also. Um, and supplements, we use a lot of vitamin D
Yep.
for, mostly after chemo, for
Is any
bone health.
is any contraindication of vitamin D during chemo?
No, I think people take it. I think
Okay.
sometimes our physicians just want to simplify everything. So they're
Okay.
like, don't take anything because then if you have side effects or your labs are abnormal, it's really nice to be able to narrow it down more to
Okay.
treatment related rather than maybe a
Okay.
supplement that they're taking.
But it is not like it's creating any interaction with the chemotherapy they get in, right?
Not with like the standard vitamin D multivitamins. Usually those are fine.
How about magnesium?
Magnesium is good. I really feel like that helps people with cramps and sleep.
Okay.
And so I agree with magnesium. But
I thought was I have something I cannot think of. So somebody told me it's a supplement that they say that they didn't want them to take during chemo. I don't know if that was during chemo or radiation. I cannot think of. Do you know of anything that you say? Maybe vitamin C?
maybe, yeah, I haven't heard that, but
Okay.
that could be.
Okay. I something I don't remember if that was during chemo or radiation, which I was not aware of. So I was like,
Yeah.
sometimes, I recommend patients to really increase protein just because that will help them. Unfortunately, yeah, chemotherapy is going to put your body into an inflammatory state. So anything they can do to get themselves increased protein that really helps with inflammation. So
Mhm.
definitely for them to try to do that going through chemo. What are your thoughts on intermittent fasting?
I don't really have enough information about it. I know a lot of people are doing that, but I don't really have a comment.
Okay, that's okay. That's okay. Yes, I have seen really good things with patients as well, like less nausea, less
Oh, okay.
fatigue. So has been really, so I sometimes tell patients to just go check it out.
Mhm.
If they've been like not to just go fasting right away if they have never done it
Right.
before, but they start to prepare themselves and give it a try and see what happened with that. So we have seen some good things in what I can see from just symptoms, right, from patients. Um, what are some common misconceptions patients have about chemotherapy or target therapist?
I think one of the main things I've seen is they automatically assume they're going to lose weight. So some people just eat because they don't want to lose weight. But in actuality, a lot of them gain weight because of the medications that we're giving them. So that kind of struck me. Um, and of course, you know, I'm trying to think what else.
Like the hair loss but all that
Yeah,
depending on the chemo, right?
that's dependent on the chemo. I think that they also that just because their friend maybe had chemo and did terribly, that they're going to also, that everyone's the same, but everybody's truly so different. And some people can skate through some of it. Some people have every single side effect. It just is, it's different in everybody.
Okay. And that's good for patients to know, right? And then sometimes if we talk about like other target therapies, then we start going into some of the AIs and the tamoxifen. So yeah, that's another thing that a lot of people struggle with. So what is your advice to people on that? Because that's what I hear a lot. So since we see patients for up to 5 years to make sure they
Yeah.
don't develop lymphedema, so, the first 6 months is all about the surgery, the radiation, or
Mhm.
if they have to have chemo. But then, when I see them a year, 2 years after they're diagnosed for just for the breast cancer related lymphedema surveillance, I that's when they like, oh my God, I'm having this terrible joint pain, brain fog, fatigue. So, what is your advice on those patients?
Definitely, exercise like you, I think, exercise and sleep is always good. I think, a lot of people tend to suffer in silence sometimes, and they don't want to not take it. So then they keep having to deal with it. But, there's three medications in that AI class. So some people do respond to one over the other better. And then some, it may not lower the risk that much to switch to tamoxifen if they're eligible. So there is other ways. And then we do try and do integrative medicine
Mm.
sometimes, where people do like the acupuncture and massage and things like that. But when I go through it with them, I'm like, you have to take this for 5 years. So you can't be miserable and not be able to get out of bed
Good,
for
good.
5 years. So we
Yeah.
have to do something to see if we can help.
Okay, perfect. So I'm so glad because sometimes they ask me and I'm like, look, because you're right, they just suffer in silence. So they ask me or I hear them complaining about it. I'm like, if you're this miserable, you have to put it on the plate, right? How
Mhm.
much is the risk versus quality of life?
Right,
If you're
right,
miserable and you cannot sleep and you're horrible and you're hating your husband and
right.
everything is falling apart, then don't. But then I always tell them, talk to medical oncology, and it's
Mhm.
another, I call it the cousins. It's like another two cousins or
Yeah.
sisters of this medication that everyone has a different side effects. So you can talk to them, give it a try.
Mhm.
None of them work, and yeah, I do the same thing. There's another one that is being as well that sometimes have less effects. And if none of that work, then it's not worth you know,
Yeah,
the
yeah.
to raise your quality of life. So it's important for the audience out there to just kind of like put it on the plate. Like I always tell
Mhm.
them, it's just quality of life has to be over anything else,
Mhm.
for making those decisions. So that's important. Um, how do you help patients navigate complex treatment plans and potential side effects?
I mean, I think we, review the plan and it is complex. All of it is complex. So I just kind of reiterate at every meeting, what's going on with them. I ask them questions because I could walk in the room and say, how are you doing? And they always say good. But if then I say, oh, are you having diarrhea? And they're like, oh yeah, 10 times a day. So kind of delving in deeper to people see how they're really doing and then what questions they have because they can only retain so much. So just trying to repeat it each time and answer any questions. And
Okay.
then I encourage them to send us questions through the portal if there's, more they think about it after they've left here.
Okay.
To try and do that.
Got you. How do you personally manage the emotional impact of working with patients facing life-limiting illness, like for yourself?
Well, yeah, I mean, I feel like I said before, it kind of gives me a sneak peek and that helps me a little bit. I just allow myself to be sad because it is sad. There's also a lot of good that happens. Outside of here, I really enjoy knitting. I
Good,
love reading, so I can go in a
good.
book.
Yes,
And I run. So it's a lot of little outlets that I use to keep going.
very good. Excellent. I think that's important. I think that as one of the things that happened to me when I was doing orthopedics before, PT in ortho, and when I was asked to just come and help to grow this program, I was like, there's no way I can do this. I have never seen patients with oncology. And my first thought was, it's going to be so sad. And I'm going to and I'm such an emotional baby. So I'm like, I'm going to be crying with them all the time. And it's like, I don't think I really would like this. I'm like very pushy and high energy. And it's like, I don't know if this is going to be a good thing. And when I came here and I shadow one of my colleagues, Shannon here, I totally fall in love with the patients.
Mhm.
Like within a week, it's like the best patients, right? And again, our majority is breast cancer, but I think every patient I've been facing has been an inspiration and a learning from me to kind of see life from a different perspective, right?
Mhm.
So it's like when we're thinking, oh my God, it's sad. And yes, has been sad moments. Yes, we lose patients, which we hate it, and we get sad and we get a space. And I cry with the family members who come and tell me the bad news and those kind of things. But you're right, in general, it is just really give us so much rewarding, right?
Mhm.
More than sadness. And it's nice to help them to navigate through those little steps and see them on the other side, right? They come up pre-op like freaking out because they don't know what's going to happen and they're waiting and waiting on surgery days. And then it's nice to see them after surgery calm down and they're just waiting for this oncotype. And then, oh, I don't
Yeah.
chemo, that's exciting. Or yes, I'm done with radiation and they get excited to be done with that part of
Mhm.
their life. So yeah.
Well, I agree. I think cancer happens to really nice people, and
Yes.
they're very grateful
Yeah.
for all the care.
Yeah, that's totally true. Yeah.
Mhm.
Have you seen significant changes in cancer treatment during your career?
I'm fairly new here. I feel like I'm still kind of new, but even over this 3 years, I've seen an increase in like the molecular um, testing, the targeted therapies, and hopefully we're getting more towards the circulating tumor cells, identifying when those come back for early intervention. So I think a lot is coming, and little by little, we're learning new things every day.
You want to expand a little bit about the circulatory tumor cells?
Yeah, so they've we've used them really effectively in melanoma, especially whereas people may have they take part of the tumor and then they are able to measure tumor cells
Mhm.
and then draw their blood at different time points after we've started treatment or even as surveillance where
Mhm.
they can say you don't have any we get them to negative
Mhm.
and then we keep following it so that if they for some reason pop positive,
Mhm.
we can act on that quick.
Oh,
And
wow.
that may lead us to do a scan or some other type of investigation to see what's going on. And we trend that over time so we can kind of see how we're doing. So I see that really advancing to all the cancers over time and
Yeah.
even getting more specific to, hopefully someday we'll be able to just go to our doctor and say, can you test my blood for any circulating tumors
Yeah. Yeah.
at all?
Isn't that similar to like this Centera test?
Yeah, that's the
Okay.
Signatera.
That's the
Yeah.
signature test. Okay. And that's done. I know they've been using that quite a bit for head and neck. And I
Yes.
know it's no, I hear something from another medical oncologist that I interviewed in the past that hasn't been as precise with breast cancer yet. Is
Mhm.
that correct?
Right. Yeah, it hasn't been used as much, but yeah, I think um, it's still more to come on that one.
Okay, awesome. And I know as well that you guys are doing in some of the triple negative as well, more immunotherapy with it, right? As a and
Yes.
the pre-op part of it, which I'm so glad. I had a patient as well that was asking actually Dr. Daly, like she had a second opinion over Moffitt, and
Mhm.
they were offering that part, and she came and asked her, like, would you do this for me? And at that point, we were not. And so
Um,
she just went ahead and did it over Moffitt, did surgery here, radiation here,
okay.
but then the chemo was over there because she wanted that.
Yeah.
And then I was like, I hear like 6 months later they started doing it here, and I'm like, oh,
Yeah. Yeah.
so I'm kind of glad we did that. I think they have seen really good results with it.
Yes. Yes.
Okay, perfect. Um, and what I don't know if this is linking or similar to the question before, but what advancements in oncology care excite you the most right now?
Well, I think I've been trying to read up on the mRNA vaccines for
Okay.
cancer.
Mhm.
So I'm hoping that we can advance that. So I
Would
think
you
that's
you wanna you
exciting.
wanna expand a little bit more on that for the audience?
I don't know a lot about it, but I know that they're working on like even a vaccine against breast cancer. And um, so I have to learn more about it, but
Okay,
I think that's an up and comer.
okay. And how do you see the nurse practitioner role evolving in cancer care in the next decade?
I think they're going to expand our role, because of the lack of physician help. I think, eventually my hope is that we can more streamline and, so I can learn everything there is to learn about breast cancer rather than, switching, oh, I got to do GI and prostate cancer. Not that I don't want
Yeah.
to do those. It's just, it would be nice to kind of um, just
Your
take care of one.
expertise. Yeah.
And then I would know exactly what the doctors I work with want, and we'd kind of be able to develop just a standard protocol where I could take some of the load off by seeing the newer patients. And so I think they'll need to utilize us a lot more.
Okay, very good. Well, I'm excited for you. Anything else you want to share with us before I let you go?
No, I don't think so. Thank you.
No, thank you so much. That has been really a great conversation. Thank you for sharing all your knowledge with my audience. I appreciate it.
Well, thank you for doing that.
Absolutely. Well, Karen, thank you so much and have a great rest of your afternoon.
You too. Thank
Okay,
you.
bye.